Republicans do not control all of Washington. You need 60 votes in this.
Well, you control the House, the Senate. The majority, yeah.
We have the majority, but that is not control.
But I understand.
Yeah. Theoretically, a parent controls the household, but 5 kids say otherwise.
At the end of the week, Washington empties out fast. Lawmakers, staffers, they're all heading home. But not before they stop here.
Hey everybody, welcome back to the Punchbowl News Townhouse.
And I did this without you last week. I'm relieved to have you back.
I'm relieved that the townhouse still stands.
Well, we had a fly-out day rager after the show. We, jumped on tables and stuff and drank a bunch of coffee and Diet Coke. So
living large here.
With you in Austin.
All right, well, this week we are taking a sharp look at the healthcare debate on Capitol Hill with the chairman of one of the key committees in charge of it. We have Louisiana Republican Senator Bill Cassidy in the townhouse. He is super interesting. He's in the thick of trying to figure out this bipartisan plan for addressing the expiring enhanced Obamacare subsidies.
He's a doctor. He's also a senator. He's been talking to Democrats. He's been talking to the White House. Mid-December, there's going to be a vote in the Senate, and the Obamacare premium subsidies expire at the end of December. Not only do they have 41 days to do that, they also have government funding, which expires at the end of January. We are in a frantic legislative period between now and the end of January.
It's going to be interesting. We're talking to him. What's his pitch to Democrats? How does he get them on board? He's up for re-election in 26. How does he handle Trump?
Yeah.
All of these things are going to come into play, and then we're going to get some reaction from an all-star team of reporters. We have our very own Andrew Desiderio back again, as well as our friend Ryan Nobles, chief Capitol Hill correspondent at NBC News.
Yeah, Andrew for a three-peat. I think he's our first 3-time guest, which is maybe we've made a mistake, but we're happy to welcome back because we pay him, so he works for us. That's great.
There you go. All right, we are going to get into it right after a quick word from our presenting sponsor, BlackRock.
1/3 of U.S. voters surveyed have no retirement savings, according to BlackRock's latest retirement policy survey. BlackRock seeks to help more people retire on their own terms. They help people invest smarter to grow their savings, manage risk, and build confidence for the years ahead. BlackRock is helping more Americans invest better to retire better.
We've got Senator Bill Cassidy, the Republican from Louisiana, chair of the Senate Health Committee, one of the key players on healthcare. Welcome to the Punchbowl News Townhouse.
It is good to be with y'all. I have to note that, Jake, your hair's getting a little gray, man.
It is. I know.
I'm sorry,
And I turned 40 in 20 days. So you're hitting me where it hurts.
Well, welcome to the club.
I was going to say, it's the water is warm. All right, we are now 41 days from the Obamacare premium subsidies expiring. You guys obviously didn't take care of it when the government was shut down. What will we see from Republicans over the next 41 days?
Republicans will hopefully put in a plan which, instead of giving $26 billion to insurance companies, of which they will take 20% for overhead and profit, instead will give it directly to patients, where 100% goes for the care of what they wish to have. Now, and none of that's made up. Obamacare allows what is called a medical loss ratio, which is 20% to go for overhead and profit. And if you give it to the patient through, say, a health savings account, 100% goes for the care that they decide to have. Instead of the insurance company giving you permission to purchase that which you think you need, you make the decision what you need, and then you go out and purchase it. Now, there's a lot of details to be worked out, but it is a much better way to go in terms of giving power to the patient and long-term controlling healthcare costs.
Okay, let's pause there for a second. You said the critical point that was not in my notes, but it is my next question now. A lot of details to be worked out. I think people hear the president say, you're just going to get a check and you're going to be able to buy your own health insurance, which is what you just said.
No, it's not. That's not what I just said.
You said it will. Okay, so explain it a little bit. Let me just ask my question. You could explain it in that. There's a lot of details to be worked out. In the next 41 days, are you going to be able to get those details worked out? This is what would amount to a pretty significant overhaul in the healthcare system in the United States.
Not as great as you would think.
Okay.
So first, let's talk about the subsidy structure.
Okay.
There's a baseline advanced premium tax credit in the Obamacare exchange, which people are using to purchase their insurance.
Okay.
We're not changing that. You still get your baseline. and you use it to purchase your insurance. That's for people less than 400% of federal poverty level.
Right.
What we're talking about is the enhanced premium tax credit over and above the previous subsidy. And just for context, the Obamacare becomes so expensive, which Democrats admit. My Democratic colleagues in their kind of floor speeches and whatever they say in committee, this has become too expensive. Not everybody has insurance. I smile because they are openly admitting that Obamacare did not control cost and it did not provide universal access. So we're not talking about the baseline tax credit. We're talking about the incremental increase in the tax credit. So that's number one. Number two, in the One Big Beautiful Bill, or the Working Families Tax Cuts Bill, Republicans set up a mechanism whereby health savings accounts can be coupled with a bronze plan. That legal mechanism is already in place. We don't have to establish that. So, Jake, one thing people say, oh my gosh, you've got to set this up. It is already set up. Okay?
Okay.
Next, the question is, can you take that enhanced premium tax credit and instead of giving it to insurance companies, give it to the patient? That's the step you're saying might be difficult. Let me say why. Let me give you some numbers at the risk of boring the audience that will say, well, maybe it's not so much after all. I'm going to give you a theoretical.
Okay.
Under the enhanced premium tax credit, no one was going to pay more than, I think, 8.5% of their income for a premium. 8.5, 9.5, just pick a number. Let's say that somebody makes $100,000 a year. So let's call it 9.5. 9.5 is $9,500. Okay. But the second lowest cost silver plan, that's what your subsidy is based upon, costs you $8,500. Okay, so you get $1,000 subsidy. You with me so far?
Yep.
Yeah.
You could take that so it's $8,500 out of your check, but a bronze level plan is only $7,200. You can buy the cheaper bronze plan. You're saving money relative to the silver plan, and the credit we're giving you to bring you down to 8.5% or 9.5% of your income, we put into the health savings account. All you're doing is taking a credit that the patient is already due for, and instead of giving it to the insurance company, you're putting it into the HSA, and they are buying the cheaper bronze plan. Now, everything I just said is already part of how the system works, except for putting the $1,000 in the HSA.
It'd be a pretty big cultural shift, though, for people. I mean, do you think that's a lot of explanation, right? Like, I follow what you just said, but
barely.
I mean, honestly, math is not a strong suit. That's why I went into journalism.
Suspecting I am speaking to two liberal arts majors who did not study math. Okay.
Oh God, you're again hitting us where it hurts.
But let's go through that. If I were to say to you, if you go to this store and you're going to pay $3 for Dave's bread, and if I go to this store and it's right next door and I'm paying $2 for Dave's bread, you're going to go to the store where you only pay $2.
I understand that, but do you think you could get this set up before the end of the year?
So it's talking to people in industry. They're like, we're already doing this for millions of people. My family and I, we are on the Obamacare Small Business Exchange. We have an FSA. There's others who have HSAs. There's already an Obamacare exchange in which these are done.
So you do think you can get this done by the end of the year?
Speaking to people in industry, they think, yeah, we just...
No, but I'm not talking about an industry. I'm talking about Congress.
Oh, Congress. Oh, Congress and Democrats.
Yeah.
Okay, now we're back to a different question. We're now back to a political question.
Yes.
Yeah, correct.
So this is the question. John Thune has promised Democrats a vote on a bill to do something about the premium tax.
Yes.
That will be the second week in December. Now, do they want a bill which cannot get 60 votes, cannot get Republicans, that will fail, and they'll have a messaging bill? Or do they want to work together to get a bill which actually works, does get 60 votes, and we take care of the American people's issue?
You tell us. Is that going to... I
don't know that.
Okay.
But people have to come out of their, I'm going to oppose it because the other side has proposed it. They have to come out of that mindset. And if they come out of that mindset and said, let's take off our Democrat or Republican jersey and let's look for something which is an American solution, not D or R, but something that works for Americans, then I think we have hope. If the goal is, nope, we said it, we put our stake in the ground, we want something to campaign on, I'm pessimistic. If it's no, we want to help Americans, I'm optimistic.
How worried are you that Republicans get blamed if something doesn't happen before the end of the year?
Well,
and passed. I mean,
yeah.
because taking off their partisan hats, I mean, that's a big lift often in today's Congress.
The cynic, the political cynic, would say, if you're a Democrat, let's just stick it to them, the American people. Let's stick it to the American people to give us a campaign issue. I would like to think that I have enough colleagues that are more concerned about the welfare of the American people than about having a campaign issue. And that is upon which this depends. We need to take care of the American people.
Yeah, I mean, listen, I think a few things. I think there might be a situation in which they want the vote on the clean subsidies, and they might be willing to talk. I don't think they give up on the vote on the subsidies just because you might or might not be talking about a plan. So that's number one. I think you probably agree with that. They'll probably want to vote either way. Second of all, I'm skeptical for good reason that you get to, you're obviously talking to Shaheen and others now, and you're going to work through those talks, but you get to the second week of December and you got 2 weeks to enact a pretty big change.
Let me pause you again.
Okay.
The way that HSAs work is that you don't have it ready. You don't have to have it entirely set up by 1/1/26.
Okay.
Because if they get it implemented by the end of first quarter, you just save your receipts for the first part of the year.
I understand that. Yeah.
And then you submit your receipts and you get reimbursed.
Could I make another point here? I think this is something that I think is important, and it deals with the president. Donald Trump likes the idea, and we've seen it in the past, and he said it now a number of times. He likes the idea of sending checks to people with his name on it. So maybe, I don't know how he goes into the HSA thing. I don't know anything about that, but I think, you have to get Democrats, you have to get the president and the House on the same page.
So can I speak to that?
Yeah, sure.
The president, as on True Social, has made it clear that he likes the idea of not giving money to the,
Yes.
he has a real good adjective for the insurance companies, and instead giving it to the consumer. My Democratic colleagues, they want to know that whatever we pass will get a vote on the House floor. If the president endorses it, I'm pretty sure Mike Johnson will take it up. Mm-hmm. So think about that. You want a vote on the House floor. The president has endorsed this. If you vote for it, you will get your vote on the House floor. Now, there's a lot in there for all of us to like, even if you're a Democrat, particularly if you're a Democrat. So what's wrong with it?
I'm not saying anything's wrong. Go ahead.
No, I want to shift gears just a little bit, but talking about the president, right? So what can you tell us about what President Trump wants to do in this reconciliation bill? It seems like that could be one way to address the longer term healthcare proposals. I mean, are you starting to talk
I think
with
you're
this?
way ahead of us on the reconciliation bill. Everything I just described.
You hope to be bipartisan. Yeah.
And then if there is a second healthcare bill, there is so much out there which is bipartisan, which will be positive in terms of controlling healthcare costs.
And you think in an election year, Democrats and Republicans are going to come together on healthcare?
So
maybe I'm too cynical for that, but
You're not cynical.
So perhaps we could get it done by the end of January. But let me tell you why. In last December, we had a package totally teed up, bipartisan buy-in, bicameral buy-in that would do things like reform pharmacy benefit managers for both Medicare and the private market, and saving $5 billion, which we then use to fund community health centers. Is there anything in there that both parties don't like? Every party liked that.
and it still didn't happen.
Well, if you wanted to put together a package in which you achieve this, Bernie Sanders wants to fully fund community health centers. I've not talked to a single person in the Congress who does not want to reform pharmacy benefit managers. By the way we save money is it saves so much money for the person paying for the premium that they kind of, in a way, pay more taxes. They're saving so much money on a pre-tax benefit that they save money on their taxes. They pay more taxes, and the federal government collects $5 billion. That's the power of this reform. Now, could Democrats not raise their hand and say, listen, this early in the cycle, let's vote for that. It's good for the American people. I will say one more thing. You asked a political question earlier. Will this hurt Republicans if we don't do something? I would argue it will hurt anybody who doesn't do that. It is teed up, ready to go. The legislation is written, and you're going to vote no? Tell me why.
Well, because here's why. And you make fair. It's a really interesting topic. I mean, I think my theory of the case up until now has been what Democrats will say is that we had this bill out there. Republicans, if you don't pass anything, and Republicans didn't vote for it, if your talks blow up, I mean, I think where people understand Republicans control all of Washington, they don't necessarily understand.
No, wait, stop for a second. Republicans do not control all of Washington. You need 60 votes in this.
Well, you control the House, the Senate.
The majority, yeah.
We have the majority, but that is not control.
But I understand.
Yeah. Theoretically, a parent controls the household, but 5 kids say otherwise.
Yes, I hear you. Yeah, I think that's an interesting point. Is there any situation in which you would, for a period of time as an off-ramp, extend these subsidies?
You know, that is a political decision more than a policy decision.
Well, it's both, right?
Yeah. And so that political decision, if the president says he's not going to sign it, that question is really for the president. Because in our
we'd like to have him on. We'd like to have him on. We're working on that.
Good for you.
Okay, let me shift gears here because this is a very interesting conversation. You're up for re-election, so this is an interesting topic for you. The One Big Beautiful Bill, which you mentioned, is polling poorly. There's a lot of reasons why I think the president seems very frustrated by it. He says, why aren't Republicans talking more about this? And that's something we've heard from a lot of different presidents over a long time. Do you guys feel like you need some more political and substantive wins going into 26?
Good policy is good politics. And if you're viewing the politics, making your policy, I'm not sure that's the best way to do it. But if you're viewing your policy and it turns out to be good policy, it's good politics. Keep your eye on the prize, and the prize is good policy. Good policy pays for itself politically. So I'd rather not go, oh, we got to do this because, oh my gosh, my politics are X, Y, and Z. Let's work hard for the American people. And if we work hard for the American people, we will benefit.
I want to talk about Robert F. Kennedy, HHS Secretary. He promised you he'd keep the CDC Vaccine Advisory Committee without change. He's now fired all the members. Kennedy also told you he would work with the current vaccine approval safety monitoring system, and then he changed COVID vaccine standards. He's undermined vaccine standard. He hasn't given Congress a 30-day warning before major changes. And just last night, the CDC changed their website to assert the claim that vaccines do not cause autism. It is not an evidence-based claim. He told you that the CDC would not remove statements on their website around autism. Do you think he's completely abandoned everything he's told you?
Let me respond to that as a physician, as a doctor, who has seen people die from vaccine-preventable diseases. A lot of this is laced with tragedy. Because as you see vaccines rates fall, as people actively undermine the trust in vaccines, vaccine-preventable disease rates go up. We've had 2 children die in West Texas. There was a woman, granted Canadian, but still a person.
Okay, my mom's Canadian, so.
In this case, tragically pregnant, exposed to someone who had not been vaccinated for measles, and the baby is lost. Now, we have an outbreak of pertussis in my state, like an outbreak. And now we have apparently a very bad flu strain going around.
Yeah, I've heard that.
So anything which is undermining trust is not good for the American health system. So I think we need to, and by the way, to frame that with autism is a double tragedy, because clearly, there's a genetic predisposition, which when a mama who is pregnant is exposed to an environmental toxin, is going to make that child susceptible to autism. Okay, there's a genetic predisposition to this, and unfortunately, I think I read or I've heard said $600 million in research looking at the genetics of autism have been canceled. So in all this, there's a tragedy of undermining trust in something which we know is safe and will prevent vaccine-preventable disease, and redirecting attention from that which we know we have to solve in order to prevent autism towards things that we know do not cause autism. So I'd rather approach this as a physician as opposed to, I think your question is kind of a little bit political.
Well, because you're a senator too.
Do you regret supporting his nomination? I mean, you were a key vote that it's put him into this position.
So I'll answer that because I'm always asked that.
I can imagine so.
Yeah. Life is lived forward. And so what I have to do is do my best to reassure the American people that vaccines are safe, that the president believes in vaccines. He won Operation Warp Speed is one of his crowning achievements per him. He goes for his physical. He gets a flu and a COVID shot. He's very much said the kids should be vaccinated. And so so we have to work against unfortunate attempts to undermine faith and to point out that if we're going to find a way to mitigate, to prevent the rise in autism, it's going to take environmental studies coupled with genetic studies. And to cancel that research is to cancel the ray of hope for parents out there who don't want their child to have a risk for autism.
Let's talk about Trump. You voted to impeach him. You've got a tough primary, or a primary, whether you consider it tough, I don't know. Do you think the president's going to endorse you?
You know, it's been communicated the president's staying neutral. And so, you know, of course, I'd love an endorsement, but the people, going back to good policy is good politics. I've worked really hard for the people of Louisiana over the last 2 terms.
Don't forget the House.
And the House.
Come on.
This past week, it was announced that $1.36 billion is coming to Louisiana from the infrastructure bill in order to build out high-speed affordable internet across my state. Now, that'll be catalytic for many communities. I got that money for our state. 1, it was part of the infrastructure bill, which I helped negotiate. And 2, when it was getting hung up in the administration, I was the one out there pushing hard. Now, that's an example of what I've done for my state. For example, from the infrastructure package, $10.9 billion have come to my state. You can go around seeing levees being built between New Orleans and Laplace. And there's a levee that I got the money for. So when I run, I'll be running on a record of delivering for the people of my state and for the people of the United States. And I'm comfortable running on that.
And you will, you're going to run. You're still running.
Oh, yeah.
Yeah.
And you can win a primary in today's Republican Party.
Yeah.
All right. We are quickly running out of time. We always end with a rapid fire lightning round. 1, is Trump a lame duck? We wrote this week that we think he started to enter that phase.
Oh, you're saying not literally, but I don't know that. I mean, what did Mark Twain say? The reports of my death have been greatly exaggerated. And so I think that the president has a great moral suasion. And he's got a great intuition as to where the American people are. And so never underestimate the president. He is constantly underestimated. He constantly beats expectations.
In your state, this could be a big deal. The Supreme Court is considering ripping up Section 2 of the Voting Rights Act, which we've seen the political map. I know you're not in the House anymore. It's very unfortunate for you as the better chamber, more interesting chamber at least. Redistricting is happening across the country. The Voting Rights Act would just be, it would change the entire South. What do you make of it?
Well, I think it's really interesting. You talk about it. Let's talk about that politically. My state, kind of interestingly, our Republican governor and Republican legislature changed our map so that they gave a Republican seat to Democrats.
Yeah.
Which is kind of like, whoa, what'd you do that for? But now,
your old seat, right?
My old seat. Yeah. So now the plaintiffs are saying that was racially gerrymandered. The Texas case was just said, no, you can't racially gerrymander. And it was the same Fifth Circuit Court as Louisiana. I think the Supreme Court's going to weigh in. And the Supreme Court will decide if that's the case. By the way, it is gerrymandering. When you do racial gerrymandering, it is gerrymandering. And when I was in the House, people would say, oh my gosh, your district is gerrymandered. They were gerrymandered because the Justice Department said you shall draw it this way. Right. And if you don't, you were not going to approve your map. Mm-hmm. And it would be, instead of a compact, it would be long and stretchy because of racial gerrymandering. Yeah. So that said, some reason people turn a blind eye to one form of gerrymandering and they're appalled by another. I'm shocked there's gerrymandering here.
I'm going to take this last question. I know we don't like to do 2 in a row, but LSU has to hire a new football coach. Your governor says he wants Trump to pick it. I'm not sure that's the best idea, but maybe he has skills we don't know about.
This might be more political than anything we've asked today.
Is it gonna be Lane Kiffin, and should it be?
You know, I like Frank Wilson. Frank Wilson is the interim guy, and just when you thought, I'll tell you why I like him. But just when you thought that the team was going to fold because of all the mess, they step up and start to play better. And the reason I like the guy is we have something called Victory Hill. Just before the game, the team comes down. Frank Wilson has a purple suit. Anybody that has a purple suit loves LSU. It is a fashion statement about the university you love. So let's go with the guy that loves us, not the guy.
That's a big endorsement.
All right. I love it. We are going to leave it there. Mr. Cassidy, thank you so much for joining us.
Thank you all very much.
1/3 of U.S. voters surveyed have no retirement savings, according to BlackRock's latest retirement policy survey. BlackRock seeks to help more people retire on their own terms. They help people invest smarter to grow their savings, manage risk, and build confidence for the years ahead. Together, these efforts help people feel more confident about planning for the future and the life they want to live. BlackRock is helping more Americans invest better to retire better.
All right, and we are back to break down the conversation with our very own Punchbowl News senior congressional reporter, Andrew Desiderio. You know, you love him. We also have our friend Ryan Nobles.
Might be a little bit too strong.
All right, we got to give Ryan this too. Ryan Nobles, Chief Capitol Hill correspondent at NBC News.
I like Andrew.
All right.
Even though I'm an Eagles fan.
Yeah, wow. And I like Ryan. Yeah, Eagles Bills. This is like a big.
It's going to be the Super Bowl, man.
I'm going to that game.
We're going to rewatch this moment.
I'm taking my daughter December 28th.
Let's talk about the Super Bowl here at the Punchbowl News Townhouse. Yeah. This Thursday, we had Senator Bill Cassidy, Republican from Louisiana, talking a lot about healthcare. What was the biggest thing that stuck out to you, Andrew?
Look, he's got a lot of specifics, clearly, and he's thought about this for a long time. I kept thinking back to when Republicans were trying to repeal Obamacare in 2017. He had that big dust up with Jimmy Kimmel. And Jimmy Kimmel basically went after him and said, you completely abandoned every promise you made about this effort and how people would lose or not lose their health care. And so it just reminded me that this is such a politically fraught topic for Republicans, and it's something that Democrats usually win on when it comes to the politics and when it comes to elections. And we're a year out now, less than a year out from the midterms, and Democrats hope to use this issue to their advantage, mostly because of the Medicaid cuts from the big, beautiful bill. But if everybody's premiums, not everybody's, but millions of people's premiums go up starting in early 2026, that's going to be a big political problem for Republicans. To the question you guys asked him, which was, will Republicans get the blame for this? They absolutely will, because they're in power.
Right. Well, and the other thing too about Cassidy is he does appear to come to this earnestly and honestly. Right?
For sure. And he's a doctor.
Exactly. And it's his own personal and professional background that leads him to that point. But the problem is he's trying to deal with it from a practical physician standpoint, and he's doing it in a political body. You know, the question that you were asking him about, well, I don't want to make this about politics. It is about politics.
Everybody, the Republicans and Democrats are just going to take their hats off and we're all going to work together.
The other thing is, like, we always say this, and I think this is a Brezism, one of the many Brezisms we have. People make policy in a political world, right? Like we're not at a think tank as much as some people would like to be. And I tried to say this, and maybe I didn't say it well enough, but like the argument people will make is we had a perfectly good solution, which is to to pass these subsidies, which everyone has been getting now since, 2021, in the enhanced subsidies. And Republicans said no. Right. And instead they wanted to do this, and I'm just previewing what I think Democrats will say. They wanted to do this complex system, which is not going to work. And I don't know that it's going to work or not work, but like we had a solution. They said no. And I just find it hard to believe, because you need to get, and I don't know, who the hell knows where Rand comes down on this and whether there's some Republican internal problems on it, but like you're going to need to get at least at a minimum 7 Democrats. And we saw how difficult getting 7 Democrats was just to open the government, right?
Andrew, he basically said that
he knows this better than we do. So.
Way better than that. But I mean, he's working with Shaheen, having conversations. But do you think the Democratic votes are there on this?
That's one of the issues here, is that everybody assumes that any bill that Thune puts on the floor in the middle of December is going to get all 47 Democrats, and then great, you just need 13 Republicans, and then we can get this done. That's probably not going to happen.
The subsidy bill.
Right, exactly, yeah. And so that's not going to happen, right? And so one of the things that Shaheen has said, I've talked to her extensively about this, is she's trying to tell her fellow Democrats that we need to stick together on this. We need to provide the votes. We need to maximize the vote count for this, because if we actually want to make sure that people's premiums don't go up, we need to craft this in a way that can get 13 Republican votes. It can't be 13. It has to be more than that, because nobody wants to be the 60th vote.
But it's got no shot at getting on the House floor if it's only 13 Republicans.
Right, exactly. That too. And then, nobody wants to be the 60th vote. I kept saying that to myself. And then, the government funding bill that ended the shutdown and ended up being exactly 60. So,
But I also thought it was interesting. I mean, he basically said that he not only needs to get all the Republicans in the Senate, the Democrats, Trump, in order for anything to happen into the House, right? I mean, he needs the Trump endorsement.
Well, I don't think there's any world in which this passes without the extension of the Affordable Care Act tax credits. He can have
For some period of time.
Exactly. And I think you could do it if you did a year extension. You could probably then open the conversation to this policy plan he has around health savings accounts. I don't think Democrats are completely opposed to this idea. Democrats just do not believe that health savings accounts are the magic bullet that's going to solve all the healthcare problems that we have in this country. And I feel like Republicans have been telling us if everyone just had a health savings account, all of our healthcare problems would go away. Right. And that they've been saying that from the very beginning when they tried to repeal Obamacare, 15 years ago. So that's not the panacea that's just going to end all of this. You have to start with, yes, we'll agree to some sort of an extension, a year, 2 years, 5 years. But Democrats are not even going to come to the table until you put that as one of the options.
They need an off ramp. I don't think that it's going to be. I don't think politically, and again, we're working in a political world. I don't think politically it's going to be sustainable or feasible to just uproot. And I'm not saying that in a bad way. To uproot the healthcare delivery system right now without extending these subsidies. People are going to want an off-ramp. And it's not going to be like, we're not talking about, well, it's the beginning of the session and we need to get this done by the end of the congressional session. It's November and this expires in 41 days.
I mean, 41 days is, as we know, not a lot of time. The middle of
Thanksgiving's
December.
coming up.
I mean, they're not going to be here that
And also, the way he was describing it to you, I'm going through open enrollment right now. I have 4 kids. It blows my mind to make these simple, what's a deductible versus an out-of-pocket expense. And then he's saying to you guys, well, we don't have to solve it until the end of the first quarter because people will get reimbursed. They can reimburse it. They're going to find the receipt for the expenses I had.
As somebody who has done that a number of times, it's never easy.
One thing quick on the process too, just this whole idea of, is it going to be just a political vote so that people can try to bash the other side and Republicans vote for the Republican plan, Democrats vote for the Democratic plan. If Thune sets this up in a way such that there is a quote unquote side by side, it's a Senate procedure term essentially, then that tells you everything you need to know. In other words, it's not, whatever they put on the floor first is not going to get 60 votes. It's going to be something that Democrats can vote for, feel good about, be like, we voted to extend the subsidies. And then it'll have a side-by-side Republican bill that says, we feel great about the healthcare plan we just voted for. And they can say, oh, we voted to extend whatever, not the Obamacare subsidies, but something that will keep the premiums lower. And so that will tell you that this is a political exercise.
I want to talk about 2 other things about this. One, what was your reaction to how he handled the Kennedy questions around HHS?
Look, he was right. He gets that question all the time. And he does.
We've all asked it. Yeah.
Well, we got to ask it. And and the CDC, they just changed the website, basically doing the exact opposite of what Kennedy in his confirmation hearing said he would do.
Right. And there are so many other senators who, cabinet officials made promises to during their confirmation hearings that they've just completely broken or ignored. So Cassidy is not alone in that respect. Look, he came at it from the perspective of a doctor saying, I treated so many people over the years who ended up dying from diseases that later were preventable by vaccines, right? So again, he taps into his sort of like his personal background there. I think that's an effective thing for Republicans to talk about.
But he didn't answer the question.
No, exactly.
That was.
I'm looking forward.
There's no way he's going to do it because, I mean, if you go against RFK, despite his reversing on literally everything that he told Cassidy, he has a big following in this quote unquote Maha movement of people who are just think he has the answer.
But I don't even, he didn't have to answer Anna's question directly as to whether or not he wishes that he hadn't voted for him. The promise that he made during the confirmation hearing was, I'm going to hold you accountable. Yeah. What I don't think he has an answer for right now is the way in which he's going to hold him accountable.
There's no way.
His answer is just to say, well, I'm a doctor and I don't agree with what they put on the website.
He chairs a powerful committee. He could use that to hold him accountable.
There's a million ways that he could hold him accountable. But no, I understand from this. The answer is politically, I can't tell you that I think Robert F. Kennedy Jr. is a bad Health and Human Services secretary and is potentially putting people's lives at risk.
But he said that.
Yeah,
he basically said they are.
And the other thing, really quickly, and we'll get to our last segment, but is I thought it was interesting on the 2026 question, him and Cycle, President Donald Trump saying he's going to be neutral.
That was news. I don't think Senator Cassidy has said that directly before. He said essentially it's been communicated to him, which means the White House and the political team there has told him that basically the president's not going to endorse in your race. That's probably good for Cassidy. I mean, think about it. This is a guy who voted to convict Donald Trump in an impeachment trial.
You mean it's good for him that he's not going to endorse somebody else?
Right, exactly.
Well, I mean, I'm not up to date on this, but I think the other candidate is John Fleming.
Right.
Former House Republican.
But if Julia Letlow gets in, which is
the buzz that I've heard recently is she's not, but she would be an incredibly attractive candidate.
This is a good thing. Capacity is my point.
Yeah. But define for me what neutral means. Yeah. Neutral means that there isn't going to be a Truth Social post endorsing Letlow or someone else. But what does it mean about the political arm that Donald Trump has, the money where that may flow into a potential primary candidate? Obviously, the Trump endorsement is more important than anything, especially in a Republican primary. But there's a wide range of neutral in this conversation, and I don't think
that's fair.
I don't think Cassidy's completely out of the woods here yet.
ChatGPT define neutral. But I mean, Letlow would be a very strong candidate. I don't know that she gets in. I have no idea. She's very well liked among people in the Capitol, and also could raise a lot of money, and has just been a player in the Capitol. And this is a delegation. Remember, they have Speaker, majority leader. Yeah. They have the chair of the Help Committee. They have John Kennedy, who's no shrinking violet. And so it's a big, powerful delegation.
All right, we are going to go quickly round robin with our last segment. That's not going to fly. Andrew, pick us up.
So this provision that was slipped into the government funding bill last week, allowing senators to sue for $500,000 if their phone records
a rich man
are obtained. Yeah. Look,
tens of millions.
This whole story is truly bizarre. It got even more bizarre a couple days ago when I asked Senator Schumer, Republicans are saying that you signed off on this provision too. Is that true? Because Democrats came out after the fact and they were like, what the hell is this? Like, we don't want this. We want to repeal it. And Schumer said, not only did I support the provision, I helped craft it. And then in the same breath, he said, I support repealing it as well. You can't say that you support repealing a provision that you helped craft and also talk about how you actually made the provision better by extending it to future instances of senators' records being surveilled. Because his whole argument was, well, if the Trump Justice Department goes after Democratic senators, I want them to have a recourse too. Again, he was justifying the provision and then in the same breath saying, I favor repealing it. That is not going to fly.
All right, Ryan.
What isn't flying for me is Mike Johnson's defense for why he stood in the way of the resolution to force the Department of Justice to release the Epstein files. I think he's twisting himself in knots in a way to please Donald Trump that just doesn't really pass the smell test. His argument over and over again is that it's to protect the victims, to protect future investigations. The way the legislation, the resolution is written clearly allows the Department of Justice to do that to the point where some of the survivors are actually concerned it gives the Department of Justice too much leeway in not releasing this information. It's clear that Donald Trump didn't want it and Mike Johnson was running cover for him. And the way that he's tried to argue it from the perspective from his experience as a litigator, you can just tell that he's having a hard time trying to convince himself of this. And from my perspective, listening to him say it over and over again, it just doesn't fly.
The Justice Department's going to be interesting to see what they do on this. Mine is Dan Crenshaw. We reported last night he was banned for 90 days from international congressional delegation travel.
I've heard of this before. The idea that
well, committee chairs have to approve, and so he was told he cannot travel after an incident in Mexico with Mexican officials in which there was a crude toast that was made over a dinner that included alcohol. Crenshaw said on X last night that he was approved by the ethics committee to go on another trip, which he didn't go on. So how could he, the implication being, how could he travel if he was banned? Well, the ethics committee approves privately funded travel, not government travel. He was banned. I could tell you with 100% certainty that he was banned for 90 days. And he didn't deny this in that tweet. He was banned for 90 days for traveling on congressional delegation travel after a meeting September 7th or 8th with the speaker and Rick Crawford, the chair of the Intelligence Committee. By the way, Rick Crawford wanted to boot him from the Intelligence Committee. The chair, Mike Johnson, controls the committee. Mike Johnson stopped it. We'll have more on this in the coming days.
All right, mine quickly. I think the number of censures that are happening in the House, I mean, it's Republicans, it's Democrats. It is unlike anything I have ever seen.
Can we get some censors in the Senate? That would be nice. That would be fun to cover.
Maybe they should just do this in block. Like, just say, here's like 10 people we don't like. Right. We're just going to censor them all at once.
We're going to slap them on the wrist.
In some ways, you feel like there is a little bit of the kind of letting out of the House being gone for, a long time.
We still hate you.
And we still don't like it. That the being away didn't make things better.
By the way, the shutdown happened and we still hate each other.
I mean, they mattered very little before. Now that the fact that they're happening so often, they have almost no effect at all.
Zero. It's kind of amazing. Yeah.
All right. We are going to leave it there. Andrew, Ryan, thanks so much for joining us.
Thanks,
Appreciate
guys.
it.
That was fun.
All right, Jake. Another
great show.
FIO day in the books.
Yeah, great show. Bill Cassidy was super newsy. I want to put a pin in something here. He said it's been communicated to him that the president will be neutral in his primary. As we discussed, neutral is
it's a varying term. I thought Ryan had a, what does neutral actually mean? Yeah. What does that mean for the Trump allies? I think there's a lot outstanding there because he's going to be it could be a really tough primary.
Yeah, it could be. Let's talk about a few other things. Russia sanctions bill. We had news at the top of the AM edition this morning about how Brian Fitzpatrick might put a discharge petition together to put Russia sanctions on the floor. He held off. He's holding off for now as Speaker Mike Johnson and John Thune kind of work out what that's going to look like. But I think Russia sanctions are going to come to the floor. Healthcare, and we've said this in the newsletter for a long time. We've talked about it on the show. Republicans are going to be in a months-long effort to try to craft a healthcare plan. We've seen this movie before. It's not always a great movie for Republicans because, well, what do you always say about, not you specifically, but I'm sure you've said this too. Once Americans get a benefit, it's hard to change it or take it away. We've seen that with Social Security, Medicare, Medicaid, Obamacare.
And Republicans have struggled on this issue. And not only do they have the subsidies, but there's a lot of talk about trying to do a reconciliation package, trying to do something bigger with Trump. I mean, Republicans going into an election year doing healthcare and spending a lot of time on it is a risky gambit, potentially.
Really risky. And then don't forget, we talked about this before, government funding. 3 of the 9 appropriations bills have passed. That's you could say that's a big accomplishment. I understand people think it is. January 30th, the entire government needs to be funded, Anna.
We are going to be covering all of that and more. Just a reminder, it is Thanksgiving next week, so we have no show, but we will be back in December. Looking forward to more Flag Day.
Have a great day, a great week, a great weekend, a great Thanksgiving, everybody, and stay safe.